Okay, today is September 21st. I'm here with Search 6, Session 7. Dr. Jeansonne is in the chair. We are going to ask a few little questions about his experience with SERP. Dr. Jeansonne, why is it important to operate in the United States? Oh wait, let me get this out of you. I forgot to get your slate out of there.
Why is it important to operate in the United States, meaning putting implants in?
Putting dental implants in, correct.
As opposed to going to a foreign country?
Yeah.
Well, I think personally, first of all, we're dealing with people that we speak their language, number one, and secondarily, the legal system aspects of the thing, the things we need to look at in terms of legal problems you might run into or informational situations for the patient. I think it's important just to have the surgery done here as opposed to having it done, for instance, in Honduras, which I looked at that course, but I just decided that wasn't the best thing simply because, the legal system, number one, and maybe the techniques, number two, and I would think also just not knowing any better, I would think it may be something to do with the sterility and just the general nature of the surgical suites and things like that. I feel more comfortable being here. Plus, it's a lot closer. It's only 5 hours away from my home, so that was huge. It's been very, very convenient to get here.
Why is it important to operate on the live patient for the dental implants?
Live patients are totally different than a pig jaw or a mannequin or whatever, simply because you are also dealing with things that you'll have to deal with in your own practice, which is the management of patients, management of hemorrhaging, suturing, getting a good result from your surgery. I think you get a much better idea about what's going to take to have this done in your own practice by having a live patient, simply because they present you with problems. Here, so many of them that you're going to see in your other office very rarely, but having done that here, I feel very, very comfortable going to my own office to do it, because I don't feel like I'm going to run into anything there that I haven't seen something much worse here.
Excellent. How is it beneficial to learn under Dr. Michael McCracken and Dr. Guy Rosensteel?
I don't have enough positive things to say about both of them. It's just impossible to describe how easy they are to work with, the ease with which they impart knowledge, the genuine joy they have in teaching. So my thought on that would be, I've just never been in a clinical atmosphere all the way back to dental school that was better for me to learn in than here, because they're just genuine good people, number one, but they're also great teachers, and they love to share what they know. They don't seem to want to hide a secret recipe. It's just like, hey, here's the things that happen, and here's the things that have happened, and I've had these things happen to myself, meaning them, and they're happy to share that with you. So it's just been wonderful.
What benefits to your practice do you foresee by taking this CERT course?
The main thing is that I practice in a relatively small town, Louisiana. I have a lot of patients that if you treatment plan a implant for them, their thought is, well, do you mean I have to drive 45 minutes or an hour to Baton Rouge and fight Baton Rouge traffic in order to have this thing done, and then go back again to expose the implant or uncover the cover screw? And a lot of my patients just don't want to do that. So the main advantage is that I'm providing a service that they prefer to have done in my own office. And by the way, having another doctor involved, they'd much prefer to have the doctor they know, their general dentist, provide these versus going to a specialist, if their doctor is competent. And frankly, after having attended this course, I feel very confident to do that particular service for my patients, and not have to send them an hour away to have that process done.
Now, did you place dental implants prior to taking the CERT course?
I placed a couple of implants when I came from AIE, and after the AIE, I placed a couple at my office. Abundant bone situations, very, very easy places to work in. So yes, I had probably 5 in before I attended CERT, but I had already been to the AIE in New Orleans and also here, and placed several implants there before I started doing anything in my own office. But between AIE and CERT, I probably put in 5 on my own.
How much new information or new techniques have you acquired since taking the CERT course?
Absolutely huge. The main thing is just the surgery. Sitting in and even assisting. I find I'd almost rather assist than do the surgery. I know I'm competent to do the surgery, but by assisting, you see what other people do in their own practice, just techniques that you hadn't thought about. And I've learned a lot from not only Guy and Mike, but also my fellow students, just watching them do their surgeries, doing their close-up, doing their placement, just some little tricks that each one of these people have that they use in their own practices. That's been hugely important to me. So the skills I've learned on my own, you know, that I can use myself, but I've learned not just from Mike and Guy, but also just watching these 14 other doctors and some of the residents as well. Just seeing how they treat people and how they treatment plan cases, it's just been very, very valuable.
Can you tell us about the clinic and staff?
The clinic is, I was talking to Mike about it yesterday, the clinic is, you probably don't want to use this in your website, but the clinic is, I would describe it as somewhat chaotic at times, but it's a learning atmosphere. And it's the kind of atmosphere that in my own office I'd feel uncomfortable with. It's a little bit like there's a lot of people moving around, a lot of things going on, and it's kind of loud. But I think the value of that is there's a lot of excitement here. You know, it's just people doing things and they're laughing and they're sharing, and it's just been a wonderful atmosphere for me. It's not the way I run my own office, but it's a good clinical atmosphere, and the staff here is wonderful. I've had no problems with any one of them. The girls have all been very, very helpful, very knowledgeable. Anyone of them can sit in and do surgery with me, you know, anytime. So I love the whole experience. Front desk people are wonderful. The clinical staff, and then of course, you know, Guy and Mike are just fantastic people. But I've just, part of the staff to me are my other CERC students, fellow students, because I've just learned so much from each one of those people as well.
Well, any other comments you'd like to make or add in?
No, just thank y'all very much. It's been a pleasure, and we've had a wonderful time socializing. Besides everything else, you know, the clinical atmosphere is wonderful, but we've really formed a camaraderie with this group, and frankly, I feel like I've made some friends that will go through the years. So, and frankly, I'd like to come back. There are other things I'd like to just see about getting into, like maybe IV sedation. That's certainly a place I would consider to have that done more than any other place. I love the atmosphere. It's just been fantastic.
Well, Dr. Jeansonne, thank you for your time.
You're welcome. Thank you.
That's